Assalamualaikum warahmatullahi wabarakatuh, and a very good day to everyone. Today I'm Dr. Dina Fariza Salimuddin from University Health Center. Today I'm going to give some briefing regarding University Health Center UTM, mainly our clinic. Basically, it's our clinic in University Technology Malaysia, right? So without further ado, I'll proceed to my next slide. Okay, so these are all the topics that will be covered under my briefing today. The table of contents, there are basically about 10 topics that I will cover today. Right? Okay, so this is the slide for our objective of University Health Center, also known as Pusat Kesihatan UTM. Famously, usually our students here will call our clinic as PKU, Pusat Kesihatan University. So there are a few objectives of our clinic, basically for all medical health facilities. Our main concern is to deliver the best medical health service to our staffs, for our students, in order for us to ensure that all of you are in a good health status and manner. Alright, and then also our clinic also has an emergency treatment. For example, like we do have our own ambulance and our on-call system, our medic standby, and also we have some of the health prevention activities, screenings, early intervention against diseases for UTM citizens. And also we do carry out some of the promotion, health promotion basically for our students, for our staffs, regarding a healthy lifestyle. And also we have some activities which we share together with students in educational activities, right? So yep. So this is the location for our clinic. There's coordinate also, we put it here. Okay. So okay, so this is the detail for in our clinic itself. When you see here, when you come to our clinic, basically the entrance is we only have one main entrance and one exit. Previously we do have two entrances, but because of this pandemic issue, we have already we need to control in and out of people to our clinic. So we do have screening counter at the main entrance, and then after that, at the screening counter, usually we will screen whether or not you are having any symptoms related to the respiratory infection. For example, like fever, shortness of breath, cough, sore throat. So if you have all those symptoms or any one of the symptoms, we won't allow you to enter our clinic, but instead you will be directed to isolation room. Okay, so you will receive the treatment inside. You will see the doctor there and receive the treatment until complete the treatment, until you receive the medication. Everything will be done in the isolation room. If you don't have any symptoms and your temperature is normal, you will enter our clinic and straight to the registration counter. You can see here there's registration counter. Then after that, you have to wait at the waiting area, wait for our doctors to call you in. Okay, so we also have, you can see there is a medical and A&E clinic. Okay, there is a emergency clinic. Okay, so for any emergency cases, the entrance will be at the A&E entrance. You can see there. Alright. So apart from that, we do have our diagnostic lab area, diagnostic x-ray, dental clinic, we do have physiotherapy and also pharmacy. After settle everything, after you completed your treatment, you receive your medication, then you have to exit at the same main main entrance and exit. So yep. That one is represent our ambulance, in which for any emergency cases, the entrance will be at the emergency entrance, and this one is through the main entrance. Okay, so This is our director of Pusat Kesihatan University, Dr. Norashikin. She's a dental officer. I present to you our medical doctors. We have 7 medical doctors here, in which we are very dedicated doctors here, doing our responsibility and job here. Same goes to our dental officers. We have 3 dental officers, including our director as well. So, regarding services in PKU, I'm sure that this is the one that is much more interested. Students are much more interested in knowing what are the services available offered in PKU. Alright, so you can see from the treatment, down the treatment, there are medical and dental. These are the 2 main services, health services that we offer to students and also to all UTM citizens, students and also staffs. So under medical, we have a quit smoking clinic, maternal child health clinic, and also chronic illness clinic. And also we have physiotherapy. For this type of therapy, usually we need referral from it's either from our doctors or from doctors outside. You can go to either private or government hospital. When they refer you to the physiotherapy, you can bring the referral letter to us, and we do accept that type of cases. And we have hemodialysis as well. Alright, but then hemodialysis is not covered under medical scheme for international students, but we do have the service here. Apart from the treatment, we have the public health services, for example, like immunization like hepatitis B immunization, ATT, the meningococcal. We do have it here. The service is available here, but you as a student, you have to know whether all these services are covered under your medical scheme or not. So this is the clinic schedule. Very important this one. So we have a different timing of operating clinic in academic and also in semester break. But as for now, we only operate based on the semester break clinic schedule. Alright, as for now. So you can see here the timing. Sunday to Thursday we open as usual, and Friday, Saturday we open until 12:30 PM. For all public holidays we are closed. And also we do have the antenatal clinic for pregnant women on Tuesday, and also child health clinic is on Wednesday. For the chronic diseases clinic, we run it every day. Every day you can come as long as the clinic is operating. So this is the dental clinic operating hours. Right. Also, we got the division of academic and also semester break week. And as for now, we are operating same goes like as a medical clinic. We are operating on the semester break schedule. For dental clinic, just to share with you, as for now, because of this pandemic issue is not yet stable, not yet resolved yet. So for any cases, any walk-in cases, usually our dental officers, our dental doctors, they will examine you. If let's say it is not an emergency cases, they will give you appointment date for you to come some other time, to get a proper treatment, to get a complete full treatment. Or else if it is an emergency case, they will attend you there and then. So this is the treatment flow. First of all, the entrance, the main entrance and exit. We have the screening counter. If you don't have any symptoms, you may enter to our clinic and go to registration counter. If not, you have to go to the isolation room. After that, you have to wait at the waiting area, get your treatment. If needed, the doctor will order for any lab or x-ray test or even ultrasound. We do have ultrasound machine here. regularly we do ultrasound scanning for antenatal checkup for our pregnant women patients. And after settle everything, the doctor ordered medication for you. You have to go to pharmacy to collect your medication. Then you may exit through the same entrance. Okay, these are the three differences between time slip, medical certificate, and also medical report. For time slip, it only tells that the date and time that you come to our clinic. For example, if you come at 9 o'clock, usually maximum we can give you up to 3 to 4 hours of leave. Meaning that if you come at 9 o'clock, you may be exempted from your class until 1 o'clock. After that, if let's say you have class, you still have to attend. Unlike medical certificate, meaning that you are, you are exempted from class for that whole day. Okay, medical report usually it will be required if you have medical illness, and also you need some report from us to verify your illness, for example, to give to your scholarship company and whatnot. So the emergency and on-call system, this is also very important. Okay, alright. So this is a system which provide treatment out of regular clinic hours, out of our operating clinic hours. Okay. As for now, we are operating based on semester break schedule. So after that, for example, after 5 p.m. only we are operating. So after 5 p.m. For any emergency cases, it will be covered by our on-call staffs. Okay, so the staff will arrive to the clinic to attend you, to give treatment to you within 15 minutes of being called. Okay, so for any emergency cases which needed any referral to hospital, we will send by our ambulance as well. So you have to know what are the emergency cases that eligible for you to come to PKU, to our clinic, to get treatment out of operating office hour. The first one is an accident, motor vehicle accident. The second one is severe pain, very severe pain. Okay, high grade fever, difficulty in breathing, bleeding, unconscious, fainting, for patient who may endanger his or her life or others. Usually the last one is something related to psychological issue. Okay, so this is the flow. This is the flow of for any emergency cases. First of all, you have to see whether you have transport or not. If you do have the transport, you have to come to our clinic by your own transport. If possible, you call us before you arrive to the clinic, so that by the time when you come here, our staff is already be here or already ready for you to give treatment to you. Okay, but if let's say you don't have any transport, if you are staying inside the campus, you have to contact a fellow of the college. Okay, any staff of the college, so that the fellow will accompany you. They do have, if let's say they do have the transport, they will help to bring you to clinic. Okay, if let's say you don't have the clinic, and let's say in the cases that is very in severe condition, patient is very unconscious, and you don't have any other friends accompanying you, so you may call ambulance. Our ambulance will come and fetch you in the campus. Okay, so the treatment will be given in our clinic. If let's say you are stable enough to be discharged, so you, after treatment settle, you can go back to your hostel. But if let's say you are not stable enough and needed referral to hospital, we will do one. We will send you by our ambulance, and your relative will be informed by the accompanying friends. Okay, that's why we need your accompanying friends or any fellow from hostel. Alright, so medical examinations for new students. Okay, this is compulsory. This is compulsory for all international students to do medical examinations in our clinic actually. But then knowing that now the registration are all online, So if let's say you are still in your home country, you need to do a pre-registration medical checkup. Once you enter Malaysia, you come into campus, you have to come to our clinic to do a full medical checkup based on the previous medical checkup that have been done before. Alright, so it will be done in our clinic. And also you can see that I've stated there the rate is 250 ringgit, which includes the vital signs vital sign examination, urine drug examination, blood infective screening like hepatitis B, C, HIV, malaria, and also chest x-ray. Alright, all these are compulsory to be done by all international students. Okay, so the Students' Health Scheme. This is something that you have to know, because as a student, you will stay in Malaysia, so anything can happen. If let's say you are sick, so you need medical attention. If needed for you to be referred to hospital, you have to know what insurance may cover you. It's either insurance from the health scheme in our clinic, or your insurance scheme under ISE. Alright, so for this International Students Health Scheme, you have, the fees is 200 ringgit per semester, and you are entitled to get treatment in our clinic, the first one. The second one also in government hospital. In nearby here, we have 3 government hospital. So for any referral to the government hospital in certain amount of treatment, it will be covered under this scheme. But as I've mentioned down there, the treatment at private hospital is not covered under this scheme. Not covered under our scheme, our clinic scheme. So what are the services that is included in this scheme? Okay, so for medical treatment, actually all acute management is covered. All acute management in our clinic will be covered under this scheme, meaning that you don't have to pay extra on top of the 200 ringgit that you have paid in your registration fees. Okay, except for all this, you can see here the fertility and contraception, for monitoring of chronic diseases. After this, I'll go in detail what are the chronic diseases. Then the pregnancy related disease. If you are pregnant, if let's say you want to do an antenatal checkup, follow the antenatal clinic in our clinic, yes, we do have the service here, but it is not covered under your scheme, meaning that you have to pay for every monitoring and treatment here for the antenatal checkup. Okay, prosthesis, organ transplant, disabling supporting equipment, vaccination other than ATT during injuries. Okay, for vaccination, if let's say you got accident and we have to give you an anti-tetanus injection, that one you don't have to pay. But apart from that, other than that, yes, you have to pay for it. For any cosmetic treatment, and also quit smoking clinic. Okay, quit smoking clinic also will not be covered under this scheme. So these are the list of chronic diseases. So chronic diseases for the monitoring and treatment which will not be included under the scheme. Okay. For cardiovascular, for example, we got a lot of patients, we got a lot of students. Okay, it's either international or local students. They have the comorbidities prior to starting your study here. Okay, so hypertension, diabetes mellitus, dyslipidemia. For kidney disease, respiratory, connective tissue disease, cancer, for chronic infections, and so on. You can see from this list. So chronic diseases, let me emphasize, it will not be included in the medical scheme. You can have the treatment here, but you got to pay for it. Dental treatment, what are the treatment that is included in the scheme? Medications, and also for examination only. Okay, other than that, if you want to do scaling, you want to do dental extraction, IND for dental abscess, also you have to pay some amount. The medication, yes, it will be covered under the scheme. You don't have to pay for it. Okay, so dental lab, for example, for dentures, retainer, we have the service here, but it's not included in the medical scheme as well. Okay, this will be the last one, hospital referral. I've told you just now, around here we have 3 hospitals. These are the 2 tertiary hospitals, Hospital Sultanah Aminah and also Hospital Sultan Ismail, and we have another 1 district hospital, which is Hospital Kulai. Okay, so we have 3 government hospitals, which if let's say you have you need the treatment there and your insurance does not cover you, yes, our clinic will cover you in some circumstances. Okay, like this, we have written here up to 8,000 per year for international students, per year, 8,000 per year, or if let's say you are admitted, only up to 14 days of admission only, either or. Okay, either or. So, and also, yeah, you are entitled for second class ward in this government hospital. Okay, with that, I think I hope that I've shared enough info. If let's say you have any questions, any inquiry regarding any of the services in our clinic, you can just contact us. You can just contact us, and whenever you come into the campus, you can just stop by to our clinic to have some additional info if you needed one. Okay, alright, if that's I thank you.